Hello from Denver. My name is Tien. I'm with the University of Colorado, Children's Hospital, Colorado, and I'm presenting Milestone Achievements in Pediatric Emergency Medicine Fellows, Impact of Primary Residency Training. A little bit of background for you. ACGME milestones were instituted to provide a more competency-based evaluation method covering 6 major clinical domains. These domains were further divided into subcompetencies, and each subcompetency has a set of milestones up to 5 levels, which are granular descriptions of achievement within a subcompetency. Now, Pediatric Emergency Medicine, also known as PEM, fellowship programs are unique in that they are open to residents graduating from both pediatrics and emergency medicine residencies. For pediatric graduates, subspecialty fellowships must be 3 years in duration, inclusive of 12 months of scholarly activity as prescribed by the American Board of Pediatrics. However, ABEM, or American Board of Emergency Medicine, only requires EM graduates to complete 2 years of PEM fellowship training, although some fellowship programs do require 3 years for all fellows, regardless of training background. A portion of milestones for PEM were derived from both pediatric and emergency medicine residency milestones. Due to this disparate clinical training backgrounds for our PEM fellows, we aim to assess for differences in milestone achievements based on primary residency training, in particular to determine if an achievement gap exists during the years of fellowship and at time of graduation. This was a multi-center retrospective cohort study of PEM fellows from across the country. We solicited PEM fellowship program directors to submit de-identified end-of-year milestone data, as well as basic demographic information for fellows who were in training over a 3-year period. 65% of US PEM fellowship programs participated and submitted data to us, for a total of 639 fellows during this time period. The majority of fellows in our study were pediatric trained and female, which is congruent with PEM fellow demographics overall. While more Northeast programs were represented, overall the geographic distribution is reflective of where PEM fellowship programs are located. We did not identify any significant demographic differences between the 2 cohorts of pediatric versus EM trained fellows. So this first graph compares milestone scores for first-year PEM fellows with milestone scores on the y-axis and subcompetencies on the x-axis. EM trained fellows are denoted by the black line and pediatric trained fellows by the red line. As you can see, in 20 out of 23 subcompetencies, or 87%, EM trained fellows scored significantly higher than their pediatric trained colleagues, with an average difference of 0.5. Similarly, second-year scores also reflected statistical significant differences in about 70% of the subcompetencies, but with a slightly smaller gap. By graduation, there were no significant differences in any subcompetency between the 2 cohorts. Limitations of this study include lack of participation by about 1/3 of the PEM fellowship programs nationally. Some programs did not submit full data on their fellows, and only 5% of the fellows were EM trained in our cohort, which is consistent with national percentages. In conclusion, we found that EM trained fellows had higher milestone scores during the first and second year of PEM fellowship when compared to their pediatric trained colleagues. But thankfully, by graduation, milestone scores equalized regardless of primary residency training. I'd like to acknowledge my colleagues from across the country, and thank you and stay safe.